So in your practice, you help people that are suffering with like chronic headaches
Yeah.
or neck pain or facial pain.
Right, right.
Tell me about that.
Well, you know, so many times we run into people that are almost on their last rope because they've been to many other healthcare providers because of the things you were talking about: headaches, facial pain, neck issues, ear issues, and no one has been able to help them. Chiropractors, you know, you can get some relief, but typically it doesn't last, and you're right back to where you were. So we see these people in sometimes a last-ditch effort because they've tried everything else. And what we find through some of the use of our technology, that we're able to look at the muscles that control the jaw position and the bite position, and these muscles are just, they're on fire, they're working too hard. And if we can find this magical spot where things are calm and relaxed, and look at building the bite at that position, then all the symptoms are gone.
So when you make their teeth go in a comfortable position, you're saying the TMJ problems go away.
That's right. That's right.
You see this all the time, like every single week?
Every week we're working
somebody with
with
20 years of migraines, now it's gone.
Every week we're working with this. Absolutely. This is something that in many dental practices, you might work with one of these people, you know, on a rare occasion, but it's something that I've done enough of through the years that I see this on a weekly basis.
I mean, it's not a recognized specialty in dentistry, but this is your specialty. I mean, this is what you focus on.
This is what I like to focus on. That's the best way of putting it. You know, I'm a general dentist, but I've got an incredible amount of extra training in this field, and these are things that I didn't learn in dental school. None of us were taught this in school. So when you go to this dentist or that dentist, they're not going to know what's going on as far as the way this approach is done. But it's one that we know works, and we get predictable, reliable results, and we're able to take people that have had a lifetime of pain sometimes, and it's gone.
Okay, wow. So I guess, okay, so the different levels of treatment, you may have to do some dental work, maybe some orthodontics,
right?
Make a splint to get them out of pain right away.
Right. Right.
And what am I missing?
No, I mean, that's basically it. We start with getting people comfortable, and that's done with what we call an orthotic. It's a special piece of plastic.
How soon does the pain go away in many of the cases?
Many of the cases, it's the next day. Certainly within the first week to 2 weeks, you're seeing steady improvement day after day after day. And
do they call you and say, well, my headaches are gone?
That's the funny thing. Some of these people have no idea that they were feeling as bad as they were, because it becomes their normal. That's just them. They function in a state of discomfort, but that's what they're used to, so they just do it. And when they start feeling better, it's like, wait a minute, what's going on here? I never knew that I could feel like this, because I've always felt the other way. So it's very rewarding to see these kind of results, and when people come back and they're just, it's like they're a different person because they're not in pain anymore.